So one of the drugs that is now completed phase 3 trial is the pegylated PEC-20, which is a drug that breaks down the hyaluronan, which is it's a stromal barrier to drug delivery and probably has other biological effects. And the drug PEC-20 has now completed a phase 3 trial. And that drug, based on the initial phase 2 study, one would consider to be a promising agent in this disease. There's also a large trial which is almost halfway through, or a bit more than halfway through, which is a phase 3 trial of a drug called napabucacin plus gemcitabine and nab-paclitaxel. It's a randomized phase 3 trial, and that drug targets the stem cells, and we think that that's a nice target to go after, because drug resistance, recurrence after a successful treatment, is probably attributed to the stem cells that cannot be eradicated by regular chemotherapy, and by adding a drug that targets the stem cells, we may be able to eradicate them and be able to give the patient a longer disease-free interval. So that's another interesting combination. There's a new trial that is currently just launched, which is combining a drug called CPI-613, and that drug is combined with FOLFIRINOX, modified FOLFIRINOX. And that phase 3 trial is also very interesting, because this is a drug that's novel, targeting metabolism in the tumor cell that is different than the normal cell, and therefore trying to use that differential in terms of targeting the cancer. So that's another interesting. There are other drugs currently being tested. One of them is an IL-10, interleukin-10 agonist, which is combined with chemotherapy in the second-line setting. Again, interesting and looks promising. And there's an L-asparagine drug, which is again combined with chemotherapy in the second line, currently also in clinical trials. And immunotherapy, although in its traditional form of giving an immune checkpoint inhibitor, has not really shown benefit, and even vaccines have struggled. The current thought is that you can make the immunotherapy more successful, potentially. Of course, we don't know the final results, by trying to attack other cells that are responsible for the lack of the immune response. For example, the macrophages, monocytes, and this is also a very interesting area of combinations that are even being used with radiation treatment that may make the tumor more immunogenic. So there are various strategies for immunotherapy. I forgot to mention CD40 agonist, another compound that's currently being used in combination with treatment. So I personally think that eventually we're going to see an advance in the immunotherapy. It's just not happening as yet, but it will be there. I think within the next 5 years, we're going to see some major advances in immunotherapy for pancreatic cancer. People are really working hard on it, and there are very good ideas that are being used. I can tell you that.